So this morning, presented to Area Command the newest statistics on COVID. We're up about 217% in the last 2 weeks. So we had gotten to a point where we were at 0 deaths per 100,000 for 14 days, and we had like 1.5 hospitalizations per 14 days, and those numbers have doubled. Okay, that's what it looks like on paper. That's the problem with small numbers. So our deaths are back up again. We had a couple last week, so we went back up to 3 per 100,000. Hospitalizations are up to 3 per 100,000. So it is starting to tick up as we look across the state, and as we look to Europe, which is a couple of weeks ahead of us. We see the Omicron is ramping up. What we're not seeing is a big increase in hospitalization. So while we see cases on the increase, what we're really going to watch is the rate of hospitalization as our real marker for what the disease load is in the community. So I put out some new information last week on boosters, who's eligible for the second booster if they're so inclined. And we're just keeping an eye on things right now. We have plenty of masks, we have plenty of tests. Building 1 has been doing a great job of getting those out the door. People come in all the time. So I think we're kind of at a point now where we're just kind of in a moderate mode and just watching what's going on and reacting as things happen.
I've handed a few of those tests out myself, so yeah, I know it's awesome that they're free and they can just walk in, request them, and do their testing at home.
Yeah, we're seeing a lot of influenza cases. I think I'm hearing that influenza B is actually showing up again. So across the state, influenza and tuberculosis are popping back up. But there's a crud that's going around right now, and a lot of people are getting that crud. And I'm not sure if it's allergies or if it's something else, but we've got a lot of people who are asking for tests, eliminating COVID, and then treating things with other methods.
What are the symptoms that you're seeing on that? Is that lung?
Yeah, so it's fevers, headache, body aches, really all the kinds of things that you would associate with traditional influenza. We're seeing a lot of that, just a lot of cough. But it's also the height of allergy season. I mean, look around, there's pollen everywhere. It's sticking to everything. So we've got, I think, probably a case where there's multiple things going on at once, all with the same kind of symptom base.
Or you get a couple of the same thing, or not a couple of the same thing. You get 2 things at once.
So
Exactly. It was fun.
COVID test is a great way to eliminate that as something of concern.
Yep. Yeah. And just if you're sick, stay home.
Exactly. That's all I have.